do.
Well, for those of you who may be on who don't know me, my name is Jennifer Mello. I am the Contract Legislative Liaison for the Department of Education and the State Board of Education. A really sincere thank you to all of our State Board of Education members who are joining us today. They do amazing work. It's been an incredibly difficult, challenging time, as we all know, for all of us. And our State Board is no exception to that. And they've been working really hard on all these issues that are really critical to our kiddos. We have a number of legislators on. It is a little challenging on our end to completely track exactly. So know that we welcome every one of you. If for some reason I have not acknowledged you, my apologies. I don't intend to not acknowledge anybody. We have copies of the presentation we can email out. Anything we can do to be helpful to you, please don't hesitate to let us know. You can speak up, you can be in the chat box, and most of you should have my cell phone number. And so you could text me if you're having issues during the presentation. It has been a really challenging several months for all of us. And I think we're finding that there's lots of different phases to this crisis that we're in as we contemplate what's going to happen this fall and what we're seeing with the number of infections in our state and things like that. The return to school conversation we always knew it would be important and big. I think it's become even more important and even bigger. So we're grateful to get to spend some time talking to you about that today. We also, we're going to start by doing some updates just on some of the other issues that you guys have been asking questions to the Department of Education about. And so that'll be, the first maybe 10 minutes or so, and then we'll spend the bulk of the time on the return to school, because I know that's obviously the big issue right now. And we want to make sure we have plenty of time to give you all the information that we have and then answer any questions you may have. So with that, I will turn it over to the commissioner, unless she wants me to say something else.
No, thank you, Ms. Mello. I will just remind everybody that, we did notice this as a public meeting, so it is being streamed. So just wanted to make you aware of that. And sometimes as we all have learned, we get feedback if we're not muted. So I'll just remind folks to mute. And every once in a while, the powers that be can mute you if we're getting feedback. So don't be alarmed if all of a sudden we do a universal mute just to prevent feedback. So I think we're all getting used to those pieces now. But thank you so much, everyone, for joining us today. As Ms. Mello said, it's a very challenging time and a very fluid time where things are changing day by day. Or moment by moment. I have to check the news multiple times per day to keep up with what's going on, related to school opening and really everything regarding, helping our students and our staff and our educators feel safe in the opening of school. So I am joined today. I want to thank some of our partners from the Colorado Department of Public Health and Environment. I'm going to be doing the presentation, but I am limited in my knowledge of the science and the medical advice on much of this once we get into it. And so, Dr. Alexis Burkhoff and Therese Piolinetti from the Department of Public Health and Environment, and I'm sorry if I got your names a little bit wrong, are here to answer questions for us a little bit later today in the presentation. So thanks to them. Just seeing if I can move the slides. I was able to move them before. Hold on. Okay, there we go. So this is what we're going to talk about today. Today's purpose is really to keep you up to date on a variety of issues relating to school reopening. I do just want to thank our State Board of Education, my partners in this work, for being on the call today. I believe all of them are on the call, except for maybe Mr. Durham. So thank them for being here. And I thank my partner, Joyce Rankin. It's her birthday today, and so wanted to just wish her a happy birthday. Whoops.
Same to you, Katie. Thank you.
Thank you. We share that birthday together. So this is the second update we have given since the COVID-19 virus hit Colorado and the country, and we will continue to provide updates into the future, but please don't hesitate to reach out to Ms. Mello if there are questions, as I said, as things change so quickly. So thank you for being here. As I said, we know that this is one of the most important topics around is the decisions around the safe opening of schools. We all really want to get our students back into schools safely where they're best supported, you know, both from a well-being perspective, but also from an academic and a learning perspective. We know that this is a time of great anxiety for our educators, staff, and families, as well as superintendents who are trying to make all this work. We at the department and at the State Board of Education have been hearing the stress of really thousands of different perspectives on school reopening. We know that educators and superintendents are really anxious about the coronavirus, and we certainly understand and share that concern. And really, above all, I just want to be sure we all thank them for their tremendous work over the past 5 months and the tremendous work they're embarking on right now. Really, everyone is in a challenging position here. Parents are stressed from trying to work, teach, and manage their children. They're dealing with uncertain finances and keeping their families healthy. We know that school leaders are worried about getting students back to school and about supporting our students with maybe more risk factors as well. School leaders are challenged with incredibly challenging logistics to either do remote learning or reopen schools. There are challenging logistics either way. And teachers and educators are understandably fearful and have stress and anxiety about what this all looks like while the virus cases are increasing. And then you all, state and local policymakers, our State Board of Education, myself included, our district leaders and our district local public health officials are trying to make sense of it all and adjust our decisions in real time as the information warrants. So it's a really challenging time, and one thing I always try to emphasize as state policymakers one thing I always try to emphasize, is just grace and empathy for differing perspectives and understanding of the different anxiety and concerns. So being agile and flexible is really critical to our day-to-day moment right now, and things are changing quite quickly. So with that, let me go into some of our updates. All right, so what the department and the State Board is working on right now is we do have ongoing work with the governor's office to support schools with personal protective equipment and funding. We're going to go into some of that funding a little bit later, and you may have seen that the governor made an announcement to support teachers and educators with a K95 mask for at least the first, hopefully 8 to 10 weeks of the school. So we're working with them on the logistics of that. Not all of the details have been worked out there, but we are working on that right now. We're also working with districts on the allowable uses of various funding streams, like the CARES ESSER, which is the elementary, secondary school funds, and the coronavirus relief funds that the governor allocated to school districts. We're going to talk a little bit more about that in a minute. We have been doing a lot of stakeholder outreach through town halls, newsletters, email updates, webinars with superintendents, teachers, and education organizations. As you are, I'm probably on about 10 calls or webinars or Zoom meetings or Teams meetings a day, trying to keep people abreast of the latest information. And then we're also creating a stakeholder group to recommend policy considerations for the next upcoming school year. And many of you were involved in that. That was in the School Finance Act, and I'll talk about that for a minute. And then the most important thing is this last bullet, which is getting schools the tools and the guidance they need to determine how and when to safely open schools. Okay, so one of the things I just mentioned was, as we see, we're about to embark on another disruptive year, and we're already thinking about any needed state education policy adjustments. So we are getting ready to convene a stakeholder group as outlined in the School Finance Act from the last legislative session. The first meeting of that group will be late August late August or early September, and we're working on the process for putting that group together right now. But that group is tasked with making considerations from the COVID impacts on things such as the state accountability system, the state assessment system, and the educator evaluation system. So that's what they will be working on, and they will be putting together a series of recommendations on those things. And those recommendations will be ready before your next legislative session starts. So probably November, December, but we need to get that group rolling and see exactly what the timelines look like. And then there's a number of things that our state board members who are on this call are in discussions on and making decisions on. There are some things that they have authority on in just more detail level things around timelines and rule adjustments, and they have already been incredibly hard at work to alleviate any bureaucratic barriers that might be preventing our districts or our schools from moving forward. So sometimes extending timelines, extending data collections, those sorts of things, so that our school districts can really focus on what's most important right now. So obviously you've heard in the news that in order for school districts to open, they have a lot of work to do and they have a lot of additional expenses. These are some of the resources that they have to manage all of that work. The Coronavirus Relief Fund was distributed through executive order on May 18th. That was $510 million to districts, facilities, schools, and BOCES, and charter schools as well. So that was a huge influx of dollars. Those dollars must be spent by December 30th or 31st of 2020. So those are dollars that they need to expend right away to respond to their needs for coronavirus relief.
Commissioner Anthos?
Yeah.
This is Jennifer. While you're on this slide, we've gotten a question from a legislator that I'm hoping you can address real quickly. And that is, there's been a lot of conversation around how those dollars are shared with private schools. Can you just update us on the latest guidance on that, please?
Sure. And that, I'm not sure how to answer that question for the Coronavirus Relief Fund. I can answer that question for the ESSER Elementary Secondary Education Relief Funds. And unfortunately, our expert on school finance couldn't be with us today. But on the ESSER funds, and I think what you might be talking about is the equitable services provision. The Federal Department of Education issued a rule around how to distribute the ESSER funds to private schools. And there has been some disagreement from both the federal Department of Education and the actual CARES Act law itself. So as of right now, the rule from the United States Department of Education is that these monies must be distributed to private schools based on their total enrollment, not just their Title I enrollment. Whereas these funds are distributed to schools, to public schools, based on their Title I formula. So we have issued guidance that aligns with the U.S. Department of Education because they have a rule now in place requiring us to do so. But there is a legal challenge to that that several states and districts are filing. And that gets me out of my realm of expertise pretty quickly around when that legal challenge will be complete and when we can give more clear guidance to our districts.
Thank you.
Madam Chair, Katie, can I ask a question?
Sure.
Board Member Sheffel. What I've been hearing is that the private schools feel like they're not going to get the money till late December, and they feel like they need it in fall when school is ready to open. So maybe you could look into that. I think there's a concern among some private schools that it'll be so late that it won't matter.
Okay, thank you, Dr. Sheffel. We will look into that. It looks like I'm getting some text just clarifying that the Coronavirus Relief Fund, the top one, is not being distributed to private schools. I hope I'm reading that text correctly. Okay.
This is Representative Michelson Janae, and if you could just as you're going through this, my son attended a private school for, you all know. Anyway, so I got a call from them really looking for what guidance that they need to be following and having a hard time getting a hold of like the Tri-County Health Department or whatever. So to the extent where you could help us understand how we can communicate with our private schools about where they can get their guidance from as well, that would be super helpful.
We will definitely follow up with you on that, Representative Michelson Janae. I'll do some work on that and make sure, and I'll coordinate with the CDE folks and get back to you.
Thank you.
Mm-hmm.
Okay, and then we have distributed through the elementary, secondary, and education relief funds 90%, and this is by law, that 90% of those dollars go directly to local education agencies, districts, based on the Title I formula. And then we have reserved an allocation, again, allowable by law of 10%. For future needs. And so we have not determined exactly how we're going to spend that yet, because as the environment is changing so quickly, and we know that schools and districts have these coronavirus relief funds right now, we want to wait for just a little bit to see what the growing needs will be so that we can allocate those dollars in the most efficient and supportive way possible based on the changing needs of this situation.
This is Representative Esgar. When do those dollars need to be spent by?
Thank you. Those dollars, Dr. Kolsman, are you on? Can you unmute?
We'll follow up with you, Representative Esgar, quickly on that.
But those dollars do have a much longer runway. So I believe, sorry about that. I believe it is September of 2022. So these ESSER funds have a much longer allowable use time.
Thank you.
So I want to be careful on this next slide. I want to give you a general understanding of what these funds can be used for, but I do want to make sure that there's a caveat there, because the allowable uses are very detailed. And so there are very specific things you can and can't use within these broad categories. So these are some of the things that, the funds can be used for: preparing for closures and reopenings, sanitizing, protecting the health, temperature monitoring, school health clinics, meeting the mental health needs of students, facilitating distance learning, recovering lost learning time, and increasing provision of school nutrition programs. So there's a lot of allowable uses, but when you start getting into the detail of the guidance, there are some barriers that have been a challenge to districts, but in general, the ESSER funds are there's a lot more uses for those, and the coronavirus relief funds have some very detailed rules associated with them. Okay, moving on to our district's guidance.
Commissioner, so if anybody has other questions on things that aren't about return to school, let me know. Email, text, put it in the chat box, and we'll make sure we follow up with you appropriately. So thank you. Back to you, Dr. Anthus.
Thank you. So I'm going to go through some of the district guidance that we've been giving during the COVID-19 situation. And I'm going to talk a little bit about different agency roles and processes. We know that there's been, a lot of questions about who has authority to do what and to make what decisions in this current situation. So this is a visual of kind of the hierarchy of decision making and regulatory governance here. Really, if the governor makes an executive order or a state public health order by the Department of Public Health and Environment, then everyone must follow those orders, and those are requirements. Then the next level of authority goes down to local executive orders, local public health orders, and approved local variances. So there is decision-making and requirements if your local public health agency has created orders for your local community. And then related to school, there's district, BOCES, and charter policies. So those policies and decisions are made, and they need to follow anything above them. But they are made by the local boards of education, by the superintendents, and by the executive directors and the boards of the BOCES. So there really is a cascading level of governance around decision making. So what we have tried to do within that is provide guidance and technical assistance to districts, because we don't have the authority at the Department of Education to dictate or require any specific thing. So what we've been trying to do to help our schools and districts is provide guidance and technical assistance that will allow them to meet the public health orders, meet any executive orders that are in place, meet local public health orders, and safely reopen schools relative to their community status. So that's what we've been working on really over the past several months. In doing that, we have been collaborating with stakeholders to get a lot of feedback on what our guidance and technical assistance should look like. And so we have an advisory committee that works with us specifically on COVID-19 related guidance that has a myriad of folks on it, from superintendents to teachers to students to transportation directors to food service directors to help us get really clear on the logistics that are going to be necessary to pull off some of these challenging strategies. We're also using our existing stakeholder challenges, including the stakeholder channels, including our State Board of Education, our advisory councils to the commissioner. We're also providing survey links and a feedback form on our toolkit, and receiving hundreds of emails as well, providing feedback and guidance. So the first thing we created a couple months ago was actually a planning toolkit on reopening schools. And this was led by the Colorado Department of Education. And here are the elements of the planning toolkit, because there's more to planning for schools in this uncertain environment than just the health and safety. You need to think about all of these other pieces too, around policy and funding that we just went through. Planning and communications. How are you going to communicate with your staff and your families and your teachers? How are you going to think about continuity of learning when we could be pivoting back and forth between in-person learning, remote learning, or maybe a hybrid approach? And so several months ago, we were providing tools to help our districts think through those different options and what that meant for continuity of learning for our students. And then the conditions of learning too. And that's really for parts about, you know, how do you communicate and support, you know, the well-being of your students and your teachers and your families when you know that they are experiencing challenging times. I will note that the link to this toolkit is up at the top of the slide. So when you receive the PowerPoint, you'll be able to link directly into our toolkit, and you can go into each one of these sections for more detail and more tools. That toolkit is organized around these pieces. So in addition to the topic areas, we got feedback that we needed to be really clear on what was a requirement, what was just guidance, which are sort of recommendations or best practices, and then what was just a consideration. So you see here that these icons are used throughout our toolkit to provide clear understanding to the user of the toolkit, whether what they're looking at is required, whether it's just recommendations or things to consider. Now I'm going to move into some more specific health guidance by the level of COVID-19 community incidence. And this is really the guidance we've been working on in partnership with the Colorado Department of Public Health and Environment. They have really been the lead on this because this is related much more to the science of the virus and the knowledge and the data around the virus in our community. So they have led this effort. This is what we released in the last couple days. I'm going to give you the incredibly high level, but then, as I've mentioned, our partners at CDPHE are on the phone if there are specific questions about the science behind it. So the idea of this guidance is to organize health protocols based on a 3-level system. And this is the 3-level system that you've heard the governor talk about. And this is the 3-level system that is related to state public health orders. So level 1 is, the stay-at-home order, which is the most restrictive. And that means that the level of incidence of COVID-19 in the community is high. And so there are more restrictive protocols. Level 2 is the safer at home phase. And that's a more mid-level where there's a little bit more flexibility, but there are still very important safety precautions that need to be taken. And then level 3 is protect our neighbors, and that's really moving into a more flexible approach because the level of COVID virus is lower in the community. And you can see here I put the link to this guidance right here. So the goals of this 3 level of guidance is to provide decision-making tools and standards to know when and how to open schools safely. It is still the idea that we provide local authority and local decision-making, because we know, at least right now, that in some of our communities, the level of COVID virus is very low in the community. So we wouldn't want to have a blanket order or a blanket requirement when different districts and different communities will be in different levels or different phases of the guidance. So this is really meant to provide support in decision making, depending on what level your community is in. It's really meant to support in-person learning in as safe and as healthy a way as possible. The idea is also to minimize disruptions to education. So you'll hear me talk about cohorting. You may have heard from your districts that this is an incredibly challenging thing to do feasibly, and they are right. But it is also a tool that helps us minimize disruptions to education, because if you have students and teachers in a cohort, if you do get a positive test, you would only need to disrupt the education for the folks in that cohort. We also wanted to ensure equity and educational opportunity. So that's where, if we can, provide flexibility to support our students who may be more at risk or need more in-person learning, and prioritize that. And then encouraging flexibility, adaptation, and innovation as schools develop novel approaches to disease control. So as we all know, we're all learning on a week-by-week basis here, and our districts are wonderful places where we can learn from about what's working and what's not. And then, as I mentioned, we want to, at this point, allow for regional approaches based on the COVID-19 incidents. Okay, so now I'm just going to go through the high level, areas that guidance addresses. And what we talked about a lot as we were developing this guidance, and the doctors and the epidemiologists that led this guidance creation, Dr. Burkoff, who's on the phone, is one of those, we really talked about layers of protection. That we can't eliminate risk 100%. None of us can do that. But the more layers of protection we put on, or strategies that we apply in the school, the more the risk decreases. And so we think about applying these topics in layers to decrease that risk. So the first the first topic we really covered in the guidance was the ages and sort of phases of the COVID-19 situation. So the guidance actually scales by age level and then varies across the determined, level of COVID incidence in your community. So this is based on the science of COVID transmission patterns. So I think you've heard that younger children are less likely to spread the virus. And they're less likely to spread the virus between themselves, but also to adults. And then younger children, excuse me, are also less likely to become ill. But as you move into the older age ranges, that starts to change. So our guidance starts to change with that science as well. In the guidance, we talk about screening and ventilation as well. We talk about ways to ensure that people coming into the school and building have screenings for temperature, symptoms, that they're doing home screenings, but also if folks didn't do home screenings, that there's also a screening availability at the school site. We know this is a good example of the layers of protection, because as you've all heard, screening doesn't prevent, somebody who might have it 100% because they might not be showing symptoms. But again, it does, you can catch, quite a few folks, and it's an important layer of protection that we add. Ventilation has also proven to be really important. We've heard a lot about trying to maximize outdoor air exchange, increase filtration of schools, and promote airflow in schools. So opening windows, making sure your HVAC systems are up to date, are all really important. Then physical distancing. This is a very high level, but more physical distancing is better, especially at older ages. We talked a lot about, and the guidance does specifically talk about a range of 3 feet to 6 feet. But we also talked about, we've sort of gotten used to this 6 feet standard, but as some of our doctors and epidemiologists have said, there's no magic in the 6 feet number. You want to increase the distancing as much as possible, but even 3 feet of distancing gives you, some risk protection. And at the younger ages, that is even more the case. So we know that younger kids, 5, 6, 7-year-olds, it's very hard to keep them physically distanced. And so what we wanted to express in this guidance is that even a little bit of physical distancing is helpful. And so, even 3 feet at the younger ages is helpful. Okay, looks like I'm running short on time. These are some of the other topics in the guidance. We have face coverings. Obviously, this is an example of where there is a state health order in place, which means that this would be a requirement as long as that state health order is in effect. So that means ages 11 and up are required to wear masks under the current health order. The cohorting piece that I mentioned is an important piece for schools to consider, because as we have to pivot and as we know there may be positive cases, the less you have to isolate the students and the teachers because they were in a cohort and they didn't mix with other cohorts, the better off we're going to be when we have to shut portions of school. We know that this is a very big challenge for our districts, and we're trying to help them with the logistics of it. Class size, right now, the younger class size is not limited. We encourage folks to look at those limits, look at the space they have, and make some good judgments, because we know not all school buildings are the same size. But there are high school limits by total students and the space, and we talk about that in the guidance. These are some other pieces that we have covered in the guidance, which is, thinking about the logistics of separate entrances and exits, staggered arrivals, departures. And again, the use of this guidance is going to vary based on the size of the school. We know that 84% of our schools in Colorado are rural schools, so there might not be as many students in those schools, so you might not have to stagger arrival in some cases. But in our larger schools, you might want to think about that. Transportation is the same. We gave guidance to try to reduce capacity, physical distancing, mask use, keep the ventilation and the windows open. And then this one is really important, persons at increased risk. Educators with risk factors, can request another assignment, a remote assignment, and there are legal protections for vulnerable individuals. This is really important. We know that teachers are very stressed about this, and so this is an important component. And then, of course, remote and hybrid learning is going to be an important choice this year. Important choice for students, for parents, and so that's really something that our districts are working hard on. So I'll end with just the feedback. I know you all are hearing a lot of feedback too. We hear from all of these folks, parents, teachers and educators, superintendents and districts administrators, and I've also met with some advisory groups of students. And they all have a slightly different perspective. You know, parents, a lot of our feedback from parents is that they're anxious to get back into in-person learning. But some of that feedback has shifted over the last several weeks from parents. We're seeing more anxiety from parents as well. Teachers and educators, they're very stressed and very anxious about this. There have been more asks lately and more local asks about having more requirements in place, you know, having more statewide orders in place, and thinking about that. The feedback we received from superintendents and district administrators is just the challenge of implementing these logistics. I think they're very interested in getting schools back safely, and they want to do so safely, but they also understand how challenging, especially for some of our big comprehensive high schools, how challenging it is to cohort and think about that with athletics and extracurricular activities. And, you know, those logistics are very challenging. And then the students I talked to, and mindful, I talked to students several weeks ago, which seems like a lifetime ago now, but there were some mixed responses there. I talked to middle and high school students. Some of them were really ready to get back to school and didn't share as much of their fear, but several of them, you know, shared with me that they do have some fear getting back to in-person learning as well. So the next steps is we will always evolve and adjust as new information or orders become available. That's been one of our challenges, is keeping these toolkits and guidance documents up to date as quickly as possible as information changes, but we're committed to doing that. And then lastly, I'll just share for the more in-depth presentation on those topics I shared with you, the CDPHE, some of the doctors that helped us develop this, they provided slides here and a recording from our Monday town hall. And so you can get much more in-depth information about the details of the health guidance. So with that, I will close things up.
Commissioner, we have 3 questions I want to surface right now. And again, there may be more, but and I'm going to start from the bottom up because of my technology limitations. What do we know about whether districts are losing students because of COVID? Do we have data on that yet, or information?
We don't have data on that yet. Anecdotally, we have heard that many parents are choosing an online approach. They might even be moving to a different online school or situation, and they might be moving to homeschooling. So we are expecting the numbers during our October count to shift, but we don't have hard data on that yet.
Thank you. And this may be one in particular where our friends from CDPHE may need to assist us with. This question, I hope, Rep. McLaughlin, you don't mind that I'm letting, well, you put it in the chat, so I assume you don't, this is not confidential. Rep. McLaughlin is from the Durango area. Her comment is, we have a lot of cases in our tourism-oriented districts, but the COVID data goes back to their home state and is not always reflected in our numbers. In other words, we have more cases than being officially reported. Will that affect our guidance? Katie, is that for you, or do you want to ask one of our colleagues at CDPHE to address that?
You know, I can give the headlines, but if Dr. Burikoff wants to add in, she can certainly do so. I think that is one of the challenges, Rep. McLaughlin, of like which data are captured in Colorado based on tourist industry. I would say that your local public health is still the authority on this because they know more about that data and they have a broader sense of that. So they would be looking at the guidance that CDPHE just provided, the ones we're talking about today, and they would be assessing the situation in their community and determine which phase they think would best be appropriate for their districts. Dr. Burkhoff, do you have anything to add to that?
Sure. I think everything you said is totally correct, that local public health really does have a kind of more holistic understanding of what's going on in the community. And, you know, all of our testing numbers are subject to things like how available testing is and, you know, how likely people are to get tested, which is why we take a lot of things into account, you know, including, for example, our hospitalization numbers, which I think don't differentiate between in and out of state from my understanding. And so, you know, I think that, yes, there are always a lot of kind of caveats to looking at just the pure numbers of who's being diagnosed in any setting. But, you know, I think it is important, you know, to take the whole context into account. And I think it's correct that local public health is able to do that.
Thank you. Another question we have, and it's related to your comments earlier on in the presentation around equity, Dr. Anthos. What are we doing at a state level to make sure every kid who's working remotely has the internet access and devices they need?
Thank you. That's a really important question. So first of all, we were grateful to the governor for allocating that $510 million. We do understand that those dollars can be used for devices and to increase remote learning, such as Wi-Fi hotspots and those sorts of things. So we think districts have some resources to be able to fill those gaps within their local communities. But we still know that even with that, there are some challenges with internet connectivity. We have a small working group between our agency, the Office of Information Technology, and the governor's office to really drill down into the districts that still have capability problems. And we're trying to work directly with internet providers on behalf of those districts to support them in getting Wi-Fi hotspots. We know that it's not realistic to lay new cable fiber down, but could we at least have some stopgap mechanisms of Wi-Fi hotspots at a very low cost? So that working group is working on that problem now, and we know the urgency is even greater because, you know, we see more remote learning needs.
Thank you. That exhausts the questions we have in the chat, but I'd love to I want to create a name for this. I feel like there's this awkward virtual call pause we should do that actually gives people time to unmute themselves and ask a question. So let's pause for a moment, and if anyone has a question they'd like to just shout out there verbally, now's your chance.
This is Val Flores. May I ask a question?
Of course.
The question is, we know that there are some teachers that are better at doing this than others. And I know that some students probably expect their teachers and love their teachers. And this is nothing against those teachers, but we do know that there are some people that are maybe better communicators online than possibly others. Is there any way to think about that? Maybe within districts, per grade level, and work with that? Or am I just, you know, too far off? But I think that I'm onto something. I've had this question kind of asked of me, especially by some university people.
Thank you, Dr. Flores. I think you're right on target with that question. I think that is one of the things both our districts are working on, but also we're trying to support in some state ways. So I know our districts are trying to do some immediate professional development of how to teach remotely. That is a very different teaching mechanism And so you're absolutely right. Teachers need support and development in that. Many of our districts are leading some of those efforts with teachers that have a better understanding of that. But we are also trying to provide, through the Governor's GEARS Act, the Governor's GEARS resources, expanded our Colorado Empowered Learning opportunities and options for districts to get low to no cost professional development for teachers that are going to be teaching in a remote way. So we are expanding the statewide professional development options for districts to opt into if they would like.
Well,
Thank you, Dr.
great.
Anthus. I wanted to surface I wanted to surface a question from Senator Todd. Is the cooperation with higher education for AP and concurrent enrollment still as accessible for all students, whether they are online or, participating in person as they've traditionally done in schools?
Well, thank you, Senator Todd. We are still working very hard on those pieces. What we're trying to do throughout this crisis is to preserve as many options for our students as possible. So preserving AP, preserving concurrent enrollment, what can those look like in a remote way? I do know there were some bumps in the road on AP testing last spring. So I believe the College Board is trying to think about new strategies to make that be a little smoother this year. And I don't have all the details on how they have evolved that, but it is still something we're very cognizant of trying to preserve as many options as possible for students, even if they're online now.
Thank you. And this isn't so much a question, but I'll just ask for any comments you might have on it. The Colorado Digital Learning Solutions, do we have any, what would you say about where that is and whether that's going to be expanded, or what's the status?
Sure. So Colorado Empowered Learning is connected to the Colorado Digital Learning Solutions. So the Colorado Empowered Learning is like the overarching umbrella. And then they subcontract with different options for professional development, actual online classes. And the Colorado Digital Learning Solutions is the portion that gives the actual online classes. And so, yes, it is an expansion of the Colorado Digital Learning Solutions as well.
Thank you. Again, I don't see any more comment or questions in the comment section. Anybody want to speak up with another question? We've got about 1 or 2 more minutes. Are there any legislators who have a question? I heard some phone beeps. All right, anybody else on the line with any questions or any closing comments?
This is Lundeen. I'll just jump in. Oops, go ahead, Senator Todd.
Paul, you and I are right on the same wavelength, I think.
I think you're right.
Thank you. I think one of the other questions I want to just throw out, because I know this has been a major concern from many teachers of, we know that parents send their children to school when they're sick. And in terms of, and that's a broad statement, but we know that happens, I guess is what I would say. And I think there is much concern from our teachers in terms of the exposure and what is their extra protection, and I think it would be district by district in terms of sickness. We know that the parents send their children to school when they're sick. Oops. Did that go through?
Yes.
I think we got most of it and certainly got the gist of it. Dr. Anthus, any comments on that?
Thank you, Senator Todd. Yeah, I definitely know that there's a lot of stress and anxiety there. That is why in our guidance, we really talk about screening and around what happens, what can schools do if a child does show up sick, and maybe they can't send them home because of, the parents have already left or something like that. So we do have an element of our guidance that talks about how to have sort of a place to isolate our students and think about that. But there is absolutely an important concern and a challenge that we're trying to mitigate.
Senator Lundeen, did you have a comment or a question?
No, I appreciate the answer to that. Certainly that is a legitimate question. And I'm grateful for the governor's effort to provide additional PPE into the system as well. I think that's helpful into managing this circumstance. I think we all, as this evolves or devolves down to the people who are actually in authority, parents and children, we all need to be responsible. We need to work together as a team. It's really tough. You know, we had that image of a pyramid, information coming down from on high, and it gets a little bit more diffused as it goes down. The reality is we all need to engage and be responsible as we move forward, parents, teachers, students, and on and on. I was just going to say thank you for the call. I appreciate the work. I know you've been working diligently in a difficult environment. There's so many moving parts in education, public education policy when things are normal. And we're clearly in times when it's very different. And I'm so grateful to the work that the board has done to get us open, to get us back to normal. I'm so grateful for the work that CDE has done. I think one of the hallmarks, one of the things that people are looking for as we move into fall is some opportunity to return to life where we're human to human, where we're normal again. And public education is such a fundamental institution of who we are as a state and society. I'm so grateful for the work you folks are doing to try and get us back to normal through the power of this institution of public education. Thanks so much for the work you've done.
Thank you. Thank you, Senator Lundeen.
I was just going to close this up and, again, acknowledge, I think, if anything, the last 4 or 5 months has taught us how important schools are and the education of our children are in our whole communities and our system. I think we always knew it was important, and we've learned that it's important at a whole different level right now in terms of marking what normal looks like, a cognizance for the variety of services our schools provide to students. When all of this first hit, one of the biggest concerns was around the school nutrition programs and making sure kids had access to food. So I think it's really helped us broaden our understanding and deepen our appreciation for the work that our students and our parents and the teachers and the folks who are running the districts and all the advocates, and certainly my lovely peeps at the Department of Education, who I can tell you are working around the clock. So thank you for all of that. And Katie, I will turn it over to you for any closing remarks, and then we'll wrap up.
Yeah, thank you. I'll just reiterate really what you said, which is this is a challenging time, and I'll end with my approach, which is trying to hear all different perspectives and having grace and understanding in the anxiety and the stress in this moment. But I do know that our students are so important, and they're needing the support. And so we're really trying to do everything we can to safely get back to schools. And that's an important piece. I do want to thank my Board of Education. Many of the pictures I see up here right now, they have been incredibly supportive and thoughtful and great people to lean on and ears to listen to when I'm struggling with things. And so they have been great leaders in this effort as well. So I thank everybody. We will continue to have opportunities like this because I know that information changes quickly, and you all are very, very interested and very important leaders in this effort. So thank you so much, and I hope you have a great Friday.
Thanks, everybody. Let me know if you need anything else, please. Good night or goodbye. Good morning.
Okay,
I don't know.
Good morning.
Thanks.